In our health centers, we serve students ages 5 to 21. Many of our health centers are located in high schools, but we're able to service so many feeder elementary and middle schools. And when we connect with these families, we're able to bring them into the Cherry Health system and provide that more comprehensive care. At our school-based health centers, we do a really thorough risk assessment on their first visit of the school year. And in that risk assessment, we touch on things from substance use to seatbelt use to food scarcity to bullying. And that student might have come down for an earache, but we are given a window of opportunity to then educate them and provide resources, and hopefully in a more overarching way, make them healthier or safer, and then more successful as students and community members.
At our medical clinics, we can provide preventative care, sports physicals, vaccinations. We can evaluate kids for injuries and illnesses. We can help manage their chronic conditions at schools. And being on site in the schools is a huge convenience for our families.
We get to step into the lives of our students. We get to create a warm and welcoming environment for them in their schools, and then hopefully foster a more trusting and positive outlook on healthcare as they move into adulthood.
You really open up a path for medical services going forward.
Our goal is to make our students successful, and in order to be successful, a lot starts in the classroom. And we're able to team up and help make them healthier and make safer decisions so that they can thrive in the classroom and become more successful as community members.
First of all, I'd like to welcome you to our mobile vision unit, where we're able to take high-quality healthcare directly to our community. Most kids don't realize that they have blurred vision and they can't see things. So what we're able to do is go into the schools, test their vision, and get them a pair of glasses. They get to pick out their own frames right here on the bus. They get delivered to the school in a couple weeks, and we also notify the parents. What's really great about our mobile unit that we now have that we couldn't do before is we're able to do exactly the same things that we were able to do at our Heart of the City clinic.
I currently work in the school systems with Dr. Boss, and we recently had a student that was very nervous about coming down getting an eye exam. As soon as she walked through the door, she already started crying. She was very, very, very nervous. But by the end of the exam, she was really amazed to see the difference between with glasses and without glasses. She now could see the trees, the leaves. She's never seen that before. And for Dr. Boss to be patient and for her to experience that, it was great. I love what I do to help the children, help them see better, be able to provide them good care. It's affordable for the patients. It's just a true blessing to be able to be a part of this community.
Cherry Health provides behavioral health services within various school locations. Our mental health clinicians would receive referrals from school staff, sometimes from parents and families, and then we work with that student individually to set goals for them that they feel are in alignment with, maybe what they're struggling with, what they'd like to work on, with whatever that they might need, and we would work with them individually, usually to achieve those goals, but sometimes incorporating school staff or parents if that's part of the need. Students who seek our services really can be for any number of reasons. It's very personal based on what that student needs or what they might have going on. So sometimes that's in regards to them feeling anxious or depressed, or maybe there's some changes going on at home or in school or within their peer relationships. And oftentimes they have really difficult life stories. If they're headed down an unhealthy path or making an unhealthy decision, we're there to help them think that through and hopefully be able to make a positive decision and have a positive outcome for themselves. Recently, we had a therapist who was helping a young person navigate a really tough situation where the family had become homeless because dad had lost his job, and there's a lot of uncertainty about what was going to happen, and that student had reported finding that very comforting to have a consistent support. And that's such an honor to be able to do that they trust us enough to continue to share that space with them and hopefully see the other side of whatever the challenge or problem is that they're facing.
It's nice when the kids can come to a school setting to have their teeth cleaned or their exam done. So they are much calmer and that anxiety isn't as high.
We provide a prophylaxis, which is to clean the child's teeth. We also provide fluoride, and we also provide sealants. We also have a dental team, which will come into the school before we do, and they will take x-rays, and they will also do an exam of the teeth before we see them.
And we hope that we can make the students, when they come in here, feel comfortable and confident with the services they're getting from our dental team.
Some of them haven't been to a dentist office, and they come in scared, nervous, not sure what's happening. For an example, I will take out dental floss, and the kids think I'm going to pull their tooth because that's all they know that dental floss is used for.
We often have children who do not have a toothbrush anymore, or tell me that they have to share their brother's toothbrush. So we're able to provide them a new one.
What's great about the program and being in the program for so long is that when we see kids that we have seen year after year after year, those children tend not to have those urgent cares because we have seen them, so the parents know it's a regular thing and they have the access to it. I love a great smile. I love the access of relieving the fears of dental to children. Kids are so resilient, and they're so interested in everything that we do. And to be able to deliver that in a friendly way, in a compassionate way, it's a great job.